We're gonna get started with Jody Britton and tell us a little bit more about the Early Learning Alliance Network. And I'm already very interested. I have already loved getting to hear various things that are being done for kids and school kids, especially during this very crazy time. So we'll give you about 15 minutes and be sure to save some time for questions. And let's go ahead and get started.
Okay, hold on just a second here. All right. There we go. Okay, let me switch my people view around here a little bit. It says speaker view is not working. Is it working? Okay, cool. All right. I'm trying to get, hold on. I'm going to stop really quick so I can get rid of those error messages and start again here so that I don't, there. Okay. Okay. All right. So here we are. I miss everyone. I have not been to my house in 68 days. It's been a very long time. We had my dad was diagnosed with brain cancer the day before, or about 3 days before all the schools went on lockdown. So we've been holed up and our whole family's been hiding. So we're in our cabin right now and dealing with that. So I miss my office so much and I can't wait to get back, but I'm excited to see everybody. And Rob and I owe you so many emails. It's ridiculous. So those will be forthcoming. So we are up in Nexus and we love that space. Our organization really exists 100% to be the advocate and support for young kids and their families and their educators. Our mission, as you can see, is really 100% empowerment, advocacy, support. We are kind of best known for igniting conversations and building in opportunities that wouldn't exist if we weren't here. We were founded in 2017 by my husband and I. We are very tiny, but we are very mighty. We are 100% privately funded, which enables us to do a lot of great things for kids because we don't get stuck in some of the nuances of government funding and things like that. But we've done a lot. You know, we have over 400 preschools in our network right now. We're growing every day. I'm right now in Iowa, right on the Mississippi River, and some friends in Wisconsin and Iowa have found out that I'm here, so we're working on expanding to these states, which is fun. We do, you know, our outreach, considering all of this has happened in 2 years, it's pretty phenomenal, and I'm really proud of our team. One of the things that we've done very purposefully is create a lot of partnerships with local elected officials, and that's allowed us to do a lot of work both for families and for kids and really step up. And this is, you know, a lot of our parents say we step up when other people step out, and I'm okay with having that reputation. To give you a little bit about me and why we do this work, and then I'll tell you what we are and where we're going and how we're making some ripples and of change here. I've worked in education my entire life. First started at the age of 16, working as a paraprofessional in public education. Since that time, I've held just about every role you can have in K through 20. Some of my clients, I've been blessed beyond words to work with the White House with some of our top ed tech companies in the world, and I continue to do that work today. And it wasn't really until I had kids that I took a look at early childhood education. And one of the things that was shocking to me is that I had been all over the world on 6 continents, helping teachers and leaders and policymakers do all these incredible things in their schools. And I never stepped foot in a preschool until I had kids. And when I did, I had been just back from Dubai and helping launch one-to-one programs over there and really working on authentic work in the classroom. And then I walked in, and one of the preschools we went into for my son was had seatbelts for 2-year-olds, had a lot of worksheets starting at age 2. A lot of things that I thought, I can't run around all over the world and do these great things and not pay attention to what's going on at home. And that's kind of when this work started, because as I dug into it and kind of thinking about my own personal experience of what I was seeing, um, it really became quite clear. We have over 3 million kids under 5 in the United States. We have no systematic way to reach them. They are not part of any system unless it's a, family support service from the state, until they enter kindergarten. In Indiana, that's 7 is the required age for kindergarten, and kindergarten isn't even really required in our state. So we don't even have to touch these kids from a state perspective until they're 7 years old. There's so much that happens between birth and really 5 that's not good enough. We can't do it. Um, we have to be able to decrease enrollment times in kindergarten, get kids in the classroom, make sure that they're enrolling, make sure parents know that they need to enroll. We have the highest participation right now in our state in special education before the age of 5, but no one's really tracking that information until we came along. There's been our entire early childhood system, from pediatricians to policymakers to licensing agents. Everything's really been focused on compliance. And at the end of the day, our parents have all said, we need help. We're not educators. We're not doctors. We're not pediatricians. We don't know how to develop our kids. We don't know how to help our kids learn, especially right now when they're stuck at home with them and they have nowhere to go. They don't know what to do and they need help. And so, why do we do this work? Because we're solving these problems and we're solving them very strategically. Our top 3 priority areas are empowerment, data, and K through 12 transitions. And in the empowerment area, we really focus on STEM, early intervention, and parent education, really around learning. When we started this work, we very intentionally made a purpose to made an intentional choice to not replicate services. We don't want to do things other people are doing, and we're not. And our preschools are noticing. Really, what it comes down to, what we do, we have an amazing online presence. We have engagement from, I think, 34 states and 4 continents at this point, weekly, if not daily, which is wonderful. We have, like I said, just over 400 preschools just in Indiana that we support. We support them by providing professional development to their staff. We do networking and learn events where they can come in. We did our first one virtually, so that's online now. They can come in and really see face-to-face updates from the state Department of Education, from the state early childhood leaders, from vendors, from thought leaders. I am blessed beyond words to have the network that I do in education. And a lot of those people have never stepped foot in Indiana, but we're getting them there through the Alliance. We're scaling up very purposefully and intentionally. We spent the last 2 years trying to break our model, trying to prove like to me that I told the team, prove to me that we don't need to exist. I want you to try really hard to talk me out of this for 2 years. And all we kept finding out was, no, we kind of need to exist, which isn't a bad thing. So as we're scaling up, we're really thinking about countywide implementation. So that means that we have a countywide coordinator in place. We have a huge digital tool warehouse that our team has access to. Right now, we're running the digital dashboards and surveys for 8 counties to collect ongoing information from their families of young children during COVID-19 and how they're dealing with that. That's also being used in 3 other states. We have a remarkable system for connecting the human network around early childhood education. It is messy. In Indiana, you don't have to be licensed. There's all kinds of different pathways into this work for so many people, and we can't help them get better if they sit on an island by themselves. So we have a wonderful, tested, and and fine-tune process to really connect that network around them. We have a wonderful relationship with the Indiana Academy of the Indiana chapter of the American Academy of Pediatricians. We work with all of our mayors to support the Week of the Young Child every year. We are continually advocating for state and federal policy that really helps solve the problems back at home for us. We're getting into systems mapping where we're able to get everyone in a room that can help and support a child and map out how families can connect to those supports. It is not easy. And, you know, if we think about best case scenario, parents having a lot of kind of a hardship trying to get their kids into special education, into speech therapy, into an ABA center because they need some support for autism, into a mental health support situation. If an affluent person in a community that's well connected can't do that, what about the people that aren't connected, that might be illiterate? We do a lot of work to try and help those that are not so fortunate get access to the systems and supports that they need. We do preschool fairs in 3 different cities. At our last one, we had a mom come that's, she didn't speak any English. Her niece was with her, and her daughter was 2. Her daughter was not walking or talking, and no one had been able to translate the forms for her to date. In that second, during that preschool fair, which isn't a really big deal, but in that second, we could provide her with really quick solutions, tap into our network, and get her help immediately. So that systems mapping piece that we're doing is making sure that that system is so clean and so connected that we know exactly who to go to for help for those folks. We're doing a lot of localized data sets. We delivered our first economic impact report to the city of Fishers, and we're doing others right now to really let them know what the local impact is for early childhood. This is going to be probably, the next 6 months is going to be a big time for early childhood in terms of economic impact, because we have so many of our centers shutting down right now. They can't find people to come out of unemployment to work. They can't find people that want to really risk their own family's health and well-being to support other families. It is a difficult time. We have our own impact measures internally in Indiana, but as we reach out to every state, we're really customizing those impact measures, even at the county level, to make sure that folks are seeing the results of the Alliance, having a presence within their community. We come in, we build the relationships, we bring in all of our tools, we bring in this amazing network of national partners, and we go. And at the end of the day, what we're doing is bringing in, all kinds of opportunities for young children that wouldn't exist. We have some of our national partnerships right now. We have Osmo, early learning coding tools that we have available to our preschools that we lend out on a rotating basis. We have access to social emotional curriculum that we lend out on a recurring basis. We're trying to take away all the barriers. Anytime somebody says, I want to do this for my kids, and then they list the 10 reasons they can't, we knock those 10 reasons out of the way and get them what they need. Our financial model is really about replication, but because of my more national and international reputation, we do a lot of consulting, a lot of research, and a lot of advocacy. We're just starting to really fine-tune our partnership programs so that we can bring folks into our organization, and other organizations can bring us into theirs. So hopefully here in the next couple of months, we'll be able to finalize our partnership with a fairly large education group that's doing some really great work in STEM, so that we can be their main early learning partner around the country. We also have a companion LLC, which is very unique and very different. But our companion LLC is Mom Squad, and Mom Squad runs 100% to fund and support the Alliance. So we have revenue share in place. So everything that we sell in the first 2 years for the Alliance, we've been able to come out and provide the first ever in the country safety alert system for preschools. So that they're alerted by the police, just like a school would be, for child care centers and preschools. That's not happening anywhere else in the country. And we've brought it here and implemented it. From from an idea to actual implementation in about 18 months, which isn't bad. So that LLC is really focused on making sure that we innovate quickly. We don't mess around. We use technology to meet the needs of our families and our kids. And we take away the excuse of we've always done it, and we do it differently, and we get the job done. At the end of the day, our team is made up of folks that 100% do this work for kids. They do not do this work. We have a fairly high profile. Our organization is loved and feared at the same time, which I'm okay with, because we are allowed, we are advocates, and we do so much work on the behalf of our kids and our families. But our team right now is made up of women in Georgia, Florida, Arizona, Indiana, Illinois, and we just pull in kind of the best and the brightest and pull them together to do this work for our team. And it's working. Our website is ELAN. It's really earlylearningalliancenetwork.org, but you can do elanforkids.org and kind of get in there and dig around a little bit more. But we're pretty complex, but simple organization at the same time. At the end of the day, we do a lot of parent education, a lot of empowerment activities for parents and families in terms of helping them be better. We do a lot of engagement with our K through 12 community. We get people into kindergarten more effectively and more prepared, just from a community perspective, and we bring data along the way. So that's it. Let me go here and see if I can stop this.
All right.
Yeah.
I'm going to give you a few minutes here.
No, you're good.
What kind of questions do we have from you all as we kind of dig into this? To me, it sounds like you're trying to describe a very big, fairly all-encompassing thing in a short period of time.
Yeah. Yeah, it's a lot. It is a heavy lift, but we have systematized everything. So to us, it's super simple. We make great things happen for kids and their teachers and their families, and that's about it. How we do that is the secret sauce. So
I have a question for you. My name is Joe. I'm the executive director for Playworks in Indiana, Kentucky, and Ohio. And so, I think I have been involved in ELAC and a couple other early learning committees and think groups across the state, and that in my past life. And then when I joined Playworks, we're mainly focused on K-12 schools and youth serving organizations. But recently, we've had an influx of interest from the early ed space in terms of our professional development and support. And so we're working in conjunction with the State Department of Health to provide some of that, and Department of Education, and blah, 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 blah.
Yep.
And some private funders, et cetera. And I think what you say is very true, right? There's no organization statewide. And so it's very messy. What's the most important piece of advice you'd give an organization that, again, we name that it's not our bread and butter. We're measuring our impact and we want to understand that, but this is all about trying to meet a demand. So what is a piece of advice you would give to an organization just starting their work in early ed?
In early ed, look at what the kids need first. I think a lot of times that is so we get misguided because we try and go through these systems and structures and, you know, like Early Learning Indiana, they come to our events, Child Care Answers comes to our events, ELAC comes to our events, and we try and bring them all together and tell a different story, you know. And I think we get so sidetracked into these rails of, or these things of, you know, how can we fit into the system? The whole problem is that the system is broken and those inlets lead you down the wrong path. The reason that we've been successful is because we have 100% done from a very research-based perspective and science-based perspective what's best for kids. And when you tell that story and when you have data for that story, pretty much every door opens, you know. So for us, just to give an example, there's, of our 400 and some programs that we work with, about 320 of them are not on any state list, because they run off the grid, you know. So if you go down that pathway, you're going to automatically jeopardize your market value, you know, because there's more community than licensed centers in our state. But that would be it, you know. I don't know if that helps or not, but I think we need to remain true to what our benefit is to kids, and knowing your work and what you guys do. I know you have a benefit to kids, you know. Shout that damn message from the rooftop.
Well, you'll be happy to know that our contract with the State Department of Health, they specifically said they wanted us to try our best to engage as many non-licensed centers, ministries, and home centers as possible. So we were really excited about that.
If you need any help, let me know. We reach out. We have great connections with a lot of them. So
sure.
Yeah. What else?
Just a comment, Jody. Great job on implementing stuff, man. It's small but mighty. It's an understatement. That's amazing, the stuff you've done. That's cool. Very cool. Inspiring. Kudos.
So you had mentioned that it's you and your husband. Do you have any other team members, or is it still that small and that mighty?
I think she's frozen.
She does look frozen.
Or she's really good at sitting still. But yeah, she does have team members, I believe, like she named off a few states: Arizona, Illinois. Oh, she's reconnecting.
I'm here now. Go ahead.
Okay.
Did you hear Craig's question, Jody, about other team members?
No, I didn't. Well, and Jack, I just got cut off right at the beginning of what you were saying.
I was just saying kudos on implementation. Small but mighty is an understatement. So way to go. Great job.
Thank you.
And Joe, you were on TV last week too, I think. So that was really good too. Cool.
And I was simply asking about the size of your team. I assume by the amount of stuff that you all have done that it has grown since. So it's not just you and your husband.
We have 5 people on our team. And then we have 2, I guess I would call them advisors, one in DC and one in New York. And then we're all separated, but yeah. And my husband, I actually have, I've continued my own consulting, and my husband has his own business. So we kind of lead the troops, and, you know, I'm good at fixing leaky systems more than anything. So that's what I focus on.